There's already interest in opening medical marijuana dispensaries here in Western Massachusetts. Good evening and welcome to 22 News at 5:30. I'm Barry Krieger.
And I'm Laura Hutchinson. Public health officials are crafting medical marijuana regulations to deal with the state's new law.
And as 22 News reporter Enritis Rodriguez found out, interest in legal pot is peaking in the Pioneer Valley.
By May 1st, the Department of Public Health is expected to release the regulations and conditions that will govern the 35 medical marijuana treatment centers across the state of Massachusetts. By a 2-to-1 margin, Massachusetts voters approved the use of medical marijuana last November.
We finally passed a law legalizing marijuana and creating community options because the threat to our state is no worse than a bottle of Johnny Walker.
The law calls for 35 medical marijuana treatment centers across the state, at least one, but no more than 5 in every county. One of the biggest concerns is how the sale and the production of the drug will be regulated. Well, the Department of Public Health will oversee the operations of these dispensaries. These dispensaries will be nonprofit organizations, meaning they won't pay some taxes. And anyone with a registration card can walk in and buy up to a 60-day supply.
Certainly, they will be paying their employees, they will be paying payroll taxes, their employees will be paying income taxes. My phone's been ringing off the hook since the election with people looking to apply for a dispensary license.
Evans says the law brings an entire industry out of the shadows. Others believe it will relieve a taxpayer burden.
A lot of law enforcement folks think it's a real drain on energies to enforce what they feel is something unenforceable.
Qualifying patients, those with debilitating medical conditions like cancer or multiple sclerosis, would be eligible to register. This retired nurse says there are benefits to the drug.
It is a wonderful reliever of anxiety and also of pain.
Some feel it gives the sick a safe place to go.
I've heard from other people that there is marijuana that gets laced with things, so you really need to know what you're getting.
But longtime Amherst resident Sally Hauk is still not convinced. She voted no on the measure, but says given the growing acceptance, her beliefs are slowly evolving.
It's effective for whatever the condition may be. Maybe it's okay. How I would feel about it being in my neighborhood, I'm not sure.
But there's still a catch. The production, use, and sale of marijuana is considered illegal under federal law. And some eastern Massachusetts towns have already started redrafting zoning bylaws to keep the location of these dispensaries away from schools and downtown areas. Live in Northampton, Enritis Rodriguez, 22 News.